Now, the alcohol industry says it's extended its commitment to raising awareness around critical COVID responsible drinking and trading. The campaign is driven by the Association for Alcohol Responsibility and Awareness, AWARE. To discuss, we're joined by the CEO of aware.org, that's Ingrid Louw. Ingrid Louw, thank you for being with us, Ms. Louw. Firstly, who funds and who supports AWARE?
So good evening, Francis, and thank you for having me. So aware.org is the harm reduction body of the South African alcohol industry. Our members obviously are the main manufacturers, producers of alcohol, so the familiar names that you know, SA Breweries, Heineken, Distel, etc. We also represent the big retailers, and we represent distributors of alcohol. So predominantly the majority of people or companies that trade within the alcohol space.
Yeah. So we can therefore say this is the alcohol industry raising its voice. What is responsible drinking and responsible trading in a third wave of COVID like we're in?
So our message has always been clear about how alcohol can be part of a healthy social lifestyle. And we're always saying to drink responsibly means to drink in moderation. But obviously with COVID in the mix, it does complicate things. And, for sure we know that the alcohol industry and alcohol consumption has taken the spotlight during this period. And so we want to say to South Africans, we want to build a practical understanding of how they can reduce harm, how they can actually keep their community safe. And the message we've taken to community radio stations, and we're trying to engage South Africans in a very responsible way, because we don't want to wag the finger and we don't want to use shock tactics, but we want to get into conversation with them. And basically just very, very simple, practical advice on how to consume alcohol in the context of COVID. So if you're a consumer of alcohol, we're saying to you, respect COVID and trading protocols. Don't drink and drive or drink and walk, because we know that pedestrian fatalities are quite significant in South Africa. We're saying avoid crowds. If you go to your local and it's reached the capacity in terms of COVID protocols, then take your alcohol home and go and drink. And don't share bottles. I mean, it's cultural in South Africa. South Africans like to share everything, and so they share a bottle of beer. We're saying, rather use cups, rather use glasses, don't share your drinks. So it's very simple, practical advice that we're giving, and we're wanting just to create this awareness and this consciousness around the fact that you can still drink, and you can drink in moderation, but still try to observe the COVID protocol.
Yeah. Is this about self-preservation as well? Because if there's another complete ban on the sale and transport of alcohol, surely that will be very dire for the industry.
Not at all. I mean, aware.org has been around for 3 years. We have engaged with social awareness campaigns over the last 3 years. We do campaigns in drinking and driving. We do campaigns in underage drinking. So this is just really building on our campaigns that we have been running actually over the past year or so. And we really, because there is a deep concern that when people consume alcohol, sometimes they let their guard down. We know that taverns also have to operate within the space and also observe the protocols. So we really just want to encourage South Africans, whether you're the consumer or whether you're a trader, whether you're a tavern owner, on how you can actually adhere to government's call to action, but keep our community safe and keep the infection rates down.
You've raised something that people let their guard down, and we've gone out and about to any sort of social setting, restaurants. People take off their masks once they're eating and drinking, specifically once they're drinking, and kind of forget about it. But that's an intractable problem, isn't it?
Yeah, and I guess you find that everywhere. I mean, I have that. I go and see my doctor, and the first thing I do when I walk into my doctor's room is I sit down and I take off my mask. And she has to remind me to put my mask back on. So, this is something that we have to continue to raise awareness of. We need to make sure that we raise the collective consciousness around it. It's not only in restaurants, it's not only in taverns. This is a new way of living for us. And so we feel that with our campaign, if we bring South Africans into conversation, we talk to them constantly, we constantly raise the awareness, we're hoping that it becomes top of mind and it becomes second nature, let's say that, and then we can actually start dealing with this pandemic in a much more meaningful way.
Yeah. Finally, I mean, the alcohol industry must be concerned. We've covered some research which suggests that an outright ban could help hospitals if there's intense pressure on hospitals. But sort of these partial bans like we're doing at the moment, where you can only buy alcohol from Monday to Thursday, the research suggests that doesn't help alleviate pressure on hospitals. So there must be some concern on the part of your industry players that when things get tough, there will be an outright ban.
No, of course the concern is there, but our concern is more about consumers. Our concern is more about, the value chain, about the traders, because a lot of people rely on incomes that, that are derived from alcohol, either trading in alcohol or serving alcohol, whether you're a restaurant. But we also believe that we're engaging with government, and the engagements with governments have been quite productive. There's various work streams that are engaging with different departments of government to find ways of how we can look at multi-pronged approaches to dealing with this. It can't be a booze or a ban. And that's why also we say to consumers, just be responsible, drink in moderation, make the right choices, because then we all get to benefit. And it's not an outright ban, and then you have some, businesses that suffer. I mean, I know that hospitals and hospital beds and all of that is absolutely critical. But we do think as the industry that we need to look at a multi-pronged approach. Obviously, that's evidence-based as well.
All right. Thank you very much, CEO of aware.org, Ingrid Louw.